Good afternoon. My name is Kalisha Bonds Johnson, and I'm a T32 National Institute of Nursing Research postdoctoral fellow at Emory University's Neil Hodgson Woodruff School of Nursing, and the Vice Chair-elect of the Gerontological Society of America's Emerging Scholar and Professional Organization, or ESPO as we like to call it. On behalf of all the members of the ESPO Webinar Task Force, we would like to welcome you to this webinar entitled Addressing Issues of Diversity and Social Justice in Research and Practice, Lightning Rounds and Panel Discussion, developed by the Gerontological Society of America and supported by the Innovation Fund. The webinar is being recorded and will be posted on the GSA website. A notice to all attendees will be distributed once the recording is available. Our expert panelists joining us today are Rabbi Erika Stelman, Dr. Adriana Perez, and Dr. Andrew Porter. On today's agenda, our experts will discuss their stories and provide their insights on how to address issues of diversity and social justice in research and practice. We recognize that these are difficult and often uncomfortable conversations that might bring up many emotions. Please know that we want to create a safe and brave space. Our intention is to educate and learn and not to further oppress or cause distress. Please feel free to reach out to a mental health professional if you feel triggered and need help. Let me introduce our panelists. Oh, wait, actually, let me not do that because I think we have to give you some webinar instructions. A question and answer session will immediately follow the moderated question. The question and answer session will last about 15 minutes. You can type your questions through the control panel on your screen in the question chat box area at any time during the presentation. Finally, you will see two drop-down boxes at the top of the screen. The one to the left allows you to control which presenters you see. We recommend selecting everyone, and the one to the right labeled webcam allows you to indicate where you want the presenters to appear in relation to the slides. So now let's introduce the panelists. Rabbi Erika Stelman is a chaplain at the Horsham Center for Jewish Life and director of the LGBT+ initiatives. She has 9 years of experience providing direct spiritual care to members of a skilled nursing community, including nursing home residents, rehabilitation patients, assisted living residents, hospice patients, family members, staff, and volunteers. Active in the older adult community, she has served on several advisory committees and boards, including the Philadelphia Mayor's Elder LGBT Advisory Committee, the Montgomery County Department of Health and Human Services LGBTQ Community Engagement Advisory Team, and the board of Mary's House for Older Adults. She also serves on the Human Rights Campaign and Services and Advocacy for GLBT Elders Long-Term Equality Index Advisory Committee. Dr. Adriana Perez is an assistant professor and senior fellow at the Leonard Davis Institute of Health Economics at the University of Pennsylvania School of Nursing. Her program of research, which is funded by the National Institutes of Health, National Institute on Aging, is focused on the influence of multi-level factors of physical activity, cognitive health, cardiovascular health, and sleep among Spanish-speaking older Latinos with Alzheimer's disease and related dementias. She also serves as a multi-site PI on the study funded by the National Institutes on Health, National Institute on Aging, to leverage a national infrastructure of trusted organizations to increase representation of Latinos in dementia research. Among her many accomplishments, Dr. Perez is a fellow of the Gerontological Society of America, as well as a fellow of the American Academy of Nursing, has served as a policy advisor of the National Association of Hispanic Nurses Public Policy Committee, and was competitively selected as a congressional fellow supported by the Atlantic Philanthropies and Centers for Disease Control and Prevention Healthy Aging Program. And last but not least, Dr. Andrew Porter is an assistant professor of public health at the University of Miami School of Nursing and Health Studies. Dr. Porter is a sexual health researcher focusing on why people make questionable choices and take risks. As a sex educator for over a decade, Dr. Porter never misses an opportunity to talk about sex, sexual health, and sexual politics. Dr. Porter is also an expert educator, having held a previous position as an instructional consultant at the Schreier Institute for Teaching Excellence at Pennsylvania State University, and has been awarded numerous teaching accolades, including the Harold F. Martin Outstanding Teacher Award, the Biobehavioral Health Outstanding Teacher Award from Pennsylvania State, and the Teacher of the Year Award from the University of Miami School of Nursing and Health Studies. Full bios are available for viewing under the Handouts tab on the right-hand side of the screen. To provide context for our attendees, I will give each panelist about 5 minutes to introduce themselves using the following 3 questions to guide your comments. I believe the questions are on the screen. First, we will hear from Dr. Porter. Next, we'll hear from Dr. Perez. And finally, we'll hear from Rabbi Stelman.
Am I good to go? All right. Well, first of all, thank you for having me today, everybody, and for the introduction. It's exciting to talk, especially in these times, about issues of diversity and inclusion. And call me Andrew, please. Credentialism gets in the way of authentic and vulnerable conversations about equality and social justice. And so many of the issues that we have today are because of the economies that we put on knowledge that support marginalization, always carrying around that DR. And the emphasis that other people put on it diminishes so much of the actual work that's being done and the people who are doing that work for diversity and inclusion. And I feel incredibly privileged to be here chatting with all of you today. The same conversations that I have with my students, that privilege there. I don't know if my coworkers feel privileged to have the conversations with me all the time, but there it is. Just a little background, I always wanted to be a pianist. I actually got into Johns Hopkins Peabody Conservatory of Music for piano performance, and I was dissuaded from it because they said, you won't make any money. And now I'm a public health faculty member, so joke's on me, probably? I don't know, there's a joke in there somewhere. Right, but I do love what I do. I love being a faculty member, having these kind of conversations. I still don't know how to answer the question, what do you want to be or who are you going to be when you grow up? But I think I'm on a good path because I know that I want to make sure that tomorrow is a little bit better than today. Early on, I realized that I have this, I don't know, is it a superpower or is my brain broken? But there's a lot of topics that make other people uncomfortable that make me feel empowered. I can talk about sex, sexual health, racism, health disparities, and I can do it pretty easily. None of it really makes me stumble. Not seeing everyone's face here today, it's like speaking to a blank audience. That's a little bit of a stumbling point. But because of my ease talking about these topics, early on in my career as a student at the Pennsylvania State University, I became a student leader working in pretty trying times with all kinds of social upheavals. Doing social justice, it's what I lived and breathed. I was the student who chained myself to desk. I arranged sit-ins and sleep-ins, and I really tried to speak for people who are afraid to speak, and I'll talk more about that a little bit later as well. But that ethic of inclusion and fighting for equality continued when I joined the University of Miami 8 years ago. I was one of the first and loudest faculties who spoke out in support of Black Lives Matter and was quickly recruited to President Shalala's task force to address the needs of Black students, where we were instrumental in creating the first space for Black students on this campus, Multicultural Student Resource Center. And after my success there, I was quickly brought on to the university task force to address the needs of LGBT students here on campus. And for the first time, the University of Miami now has a center for queer students. Perhaps now as a faculty member with fewer megaphones and fewer sit-ins, but that's all still going on in the back of my head. But thinking about why I address social justice and equality in my work, I mean, part of it is because I'm a white man and I have a ton of privilege afforded to me. I have a chair at that table, so I can leverage that advantage. Not only for myself, but I can invite other people to the table as well. And that's what led me here today. Going back a few more years, I grew up as a gay child of evangelical, anti-gay parents in the Deep South. Much of my childhood was about building barriers and avoidance and lying about who I was as a self-preservation mechanism. Because if I accepted who I was and told the people around me who I was, I would have faced social exclusion, familial rejection, and community excision. So part of my journey was self-serving. I felt that I needed to escape. I needed to find a part of the world that didn't exclude me. The world felt really devoid of equity and social justice. And I want to make sure that no one else ever feels the way I did when I grew up. And I take that ethic into my work and my research and my service today. So what is the most important thing that we can do about it? I think it's important to talk about the system that we're in. Everything that we do is racist, homophobic, misogynistic, because it's all part of a system that's working as intended to achieve those ends. There is only racism and anti-racism. There is only homophobia and anti-homophobia. There is only misogyny and anti-misogyny. There is no middle ground. Any or all silence supports that system of anti-social justice and anti-equality. So in everything I do, in my classrooms, my service, and my research, I try to take active steps because without them, it supports that system. I know perhaps the most important thing that we can do is speak out when we're uncomfortable in these situations. But we as faculty grow up in environments where vulnerability is a threat. We'll be attacked for being vulnerable. Being wrong is anathema to our entire profession. So instead of sitting in cultural humility and asking questions, we either think we already know those answers or it's someone else's job to do it, right? To do that work. We hurriedly click through those mandatory cultural competence trainings. I know I've done it before as well. Social justice and equality and inclusion aren't something we gain through clicks on a computer. It's an active process where we actually have to work and commit our time and energy and effort into doing it. And I think last but not least, it's important that everybody picks up some of the slack. So much of the work that's done at universities falls to the people who are already overcommitted and overworked. We know that women of color and minorities are much less likely to get tenure at universities because they spend so much time. So asking why do I feel like it's important? I want to support all of the people around me. And like I said earlier, my little gay self still stands today saying, I want to make tomorrow a little bit better than today. So thanks for having me, everybody.
Thank you. I'm Adriana Perez. I grew up in a border community in Yuma, Arizona, and San Luis, Mexico. I come from a family of immigrants. My parents and all of my aunts and uncles were farm workers. So growing up, I, had the experience of seeing firsthand the health inequities in our system as a young person, noticing how young my parents were, but still did not have access to health care, either were uninsured or underinsured, and just taking note as a young person, going with my family, my mother, to healthcare appointments to be her translator, I think was my first introduction to and inspired me to become a nurse. I early on in school had learned the importance of mentoring and had mentors that really saw in me more than I saw in myself. And I think what was important about the lesson about mentoring early on is that I think mentoring is very powerful, and I really use that. And I know later we will talk about strategies to work through many of these issues. But that sort of early experience informed my decision to be a nurse. As I said, a mentor early on encouraged me to be a nurse, thought I would be a great nurse. And when I became a nurse, pretty much what I experienced as a young person was confirmed through my clinical practice. I saw the inequities practicing in Phoenix, Arizona, in a cardiovascular health unit, how most, especially Latina women, did not experience the same benefits and advances of research that we were implementing, or the best practices in cardiovascular health that we were implementing. I became part of a healthcare quality team to really break down the disparities at our hospital. And through that process, I was in school to become a nurse practitioner. I think at every step of my education, the reinforcement of inequities in our system continued to be validated. Then in my doctoral program, I really began to understand how systems operate to exclude people. And I think something that is persistent even today, and I've been a nurse for 20 years, is the exclusion of people of color, Black, Brown, Indigenous people, and other marginalized communities when it comes to research, when it comes to resources. And I've taken on that, tried to take that on as a researcher, That's really what's led me to address social justice. And I want to add that in addition, I feel like some of the best experiences and lessons I have learned have come from the communities that I've partnered with in that research. I often say, you know, I am a Latina, I'm from an immigrant community, a farm working community, but I don't speak for, you know, every group. I speak from those groups because I belong to those groups, but I've learned along the way too that there are a lot of subcultural differences, individual differences, and that continues to inspire me. But in terms of continuing to be inspired to address issues of social justice and equity, it really has been the participants in my research who have taught me the most. Here, you know, as nurses, as researchers, we are trained to look at a problem and address that problem, you know, fix that problem. What patients and participants and communities have taught me is that there is a lot of inherent strength in individual people and communities that we also have to take into account. So more and more my research framework really focuses on thinking about a strength-based approach to health equity. In my current work I have a study promoting physical activity in older Latinos that speak Spanish to promote cognitive health, cardiovascular health, and sleep. One of the components of that program is to really embed the community, not just in the implementation of the grant, but from the very beginning. They have been part of conceptualizing the problem, being part of the intervention, addressing the intervention, and now that, you know, there's grant funding, they are not just part of the research team, but they're being paid as part of the research team. So I'm really very intentional about the team that I've assembled, the people that are involved, and centering those voices that are often excluded. And so, you know, I think that really gets to this third question about what do you feel is most important as you engage in this work? And really two things. One is to always center the voices of those that are traditionally, historically excluded. This is really about them, about their health ultimately. And it, you know, a lot of the traditional ways in which we are trained are really not designed to take people that are marginalized into account. You know, it's a lot of what we've learned is from a paternal approach, you know, that we come in a community, we say what's wrong, we say what they need to do. In a very, you know, a brief example, in promoting physical activity, my participants in my research took me for walks in their neighborhood and identified issues that prevent them from being active. A lot of structural issues, neighborhood design factor issues, and that's really opened my eyes, and I consider this my lifelong work. The second most important thing that I feel is important for all of us, and I have found for myself as I engage in this work, is realizing that, you know, I'm in it for the long haul. So that in that process, there's a lot of self-preservation, you know, that I have to think about, sort of prioritizing the things that I can do. And I recognize there's a lot of privilege with that. You know, some people do not get to choose and pick what they will focus on. I mean, you know, issues of racism. I have colleagues that deal with racism a lot more frequently than I deal with discrimination. So I really look at, you know, for myself, staying healthy, staying well is important in this sort of long haul of working on social justice and equity, because it takes a lot of mental, you know, sort of brain power and heart to do it. And surrounding yourself with people that are doing the same work can help in that process. So it's something that I wanted to share, is that if we commit to this lifelong work, we have to sort of form structures around us that help support that work and that you don't feel alone in it. So thank you.
Thank you, Dr. Perez. Rabbi Stelman, it's your turn.
Okay. Can you hear me okay? I had to put on my headphones. My office is by the elevator. Got a little loud. So I'm Rabbi Erika Stelman. I work in a skilled nursing community, as was noted. I grew up in Baltimore. I've lived in Cincinnati, Ohio, Los Angeles, Providence, Rhode Island. And in terms of what led me to addressing social justice work, I go way back, actually, in preschool. And I was really, children do, as Dr. Perez said, children can pick up on a lot and can be perceptive and can see that things aren't fair or that people are in pain and suffering. And I think it's perhaps just the makeup of me. I also think it's my parents and people around me that help me, I think, have an open mind and observe. But I'll tell you, and I've never shared this, and I don't even think my parents know this, but when I was a little girl, so like preschool, and I would see people, and probably now maybe I would say that maybe they were homeless. I mean, but I would see people that didn't, you know, for a 4-year-old mind, whatever the word was, but I could see that they weren't necessarily so happy or healthy. Something looked difficult. And I would promise them in my head that one day I was going to have a farm and anyone could live on my farm and there'd be plenty of food. But when I think back on that, I think there's two things. It's an awareness of humanity, having compassion, being sensitive, and also feeling a responsibility. And then I guess the chutzpah, or the, you know, the ambition that I can make a difference, that I can. And so when I was 4, I knew I couldn't, but I was like promising someday. I did not have a farm, but I've done all sorts of things. When I was 14, the idealistic me with some other high schoolers created a group, Children for Worldwide Peace. And we went on marches. We had people come talk to us about what was happening in El Salvador and Nicaragua. To me, one of the very important topics was homelessness in the state of Maryland. And we actually went to the state capitol in Annapolis and lobbied. And then after college, I went back to Baltimore where I grew up. So I know the Peabody Music Institute, it's a beautiful place. I was dealing with mental health stuff. So I went back and I knew I wanted to work with children and I wanted to do some art. And I ended up getting hired to help. There was a new family center in an underserved part of Baltimore City. And I got to create and run children's programs. And I actually reconnected with a legislature that I had, as a 14-year-old, lobbied in front of. And I did metalworking. I've done a lot of different things, worked for a civil rights law firm. When I was in college, I had this thought, because I have a lot of interests and passions, but two things that have been consistent since I was a little person was my awareness, my sense of being Jewish, and that was something important to me and special, and also this responsibility that I need to do whatever I can to try to help other people and to make this world a better place. And so when I was in college, I had this thought, do I want maybe be a doctor? But the thinking basically went, I don't want to just fix people up so they can go back into society that's really broken. And there's a lot of suffering and pain. I want to work on the society, let the doctors and the, both doctors fix people up. And I just want to also just do a shout out to nurses. The nursing profession. I work very closely with nursing, and I think chaplaincy and nursing, there's a lot of overlap. So I did eventually go to rabbinical school, but I'm very grateful to be working in a healthcare environment, because I actually think this is the framework for us to combat social justice issues, that it's really about, for me, and this is how I teach it, reducing pain and suffering and increasing health and well-being. And the systemic racism and injustice impact people's health and well-being. And so, as a chaplain, I'm trained to work with everyone regardless of faith. And spirituality is about connections. It's about having purpose and meaning and transcendence. And it really is a key part when we're talking about diversity and different identities and health and well-being. And so I'm just very grateful to the Gerontological Society of America and to all the people. There are so many incredible people that are not that are behind the scenes that put this together, and I'm very grateful to Dr. Bonds Johnson and Dr. Porter and Dr. Perez to be part of this. And in terms of most important, there's a lot, and I can I'll elaborate. But one is that we can't do it alone. That we need to work with other people. And I have, through just this event, I've now gotten to meet some very special people that hopefully, we will be continuing conversations in the work that, we're not going to cover everything today. Hopefully this is a beginning of ongoing work and discussions, but to remember that two things, that each person can make a difference. And part of it is just being open and seeing each and every person as, I would say, as a child of God, but you could just say we're all equally human. We're there, and this is the last thing, that each person is unique, and each person, and we're all equally human. Okay, thank you.
Thank you. Thank you all for those introductions. We are going to get ready to get into the moderated questions. I think you all bring unique lenses, and so it'll be interesting to see how you all tackle these questions. Time is getting away, so let's get started. So question one is, how do we make diversity, equity, and inclusion a priority in our teaching, research, or practice? Can you give us one or two examples or strategies that have been important in your own work? It can be something you are doing or preparing to do. We'll start with Rabbi Stelman.
Thank you. So, so this is a big question, and so I think the word strategy is really important, and I think each person is going to have to think about what works for them, given, where are they in their career, what organization are they working with, what is the culture of that organization, do they have allies to work with, so there are many, many factors in terms of thinking through a strategy, but one good place to begin is when you're able to normalize discussions of the issues. There's so much stigma, there's so much shame, there's so much marginalization, whatever, with respect to, the diversity in terms of race or religion, and there's intersectionality, right? So we have, subgroups, people have multiple identities. So my dear friend who's a lesbian, Black, Jewish rabbi is going to have a lot of, different experience. She has had a lot of different experiences and will than I do. We're both Jewish, we're both women, we're both members of the LGBT community, but we have differences. So to be aware that every person we meet is going to have multiple identities, but that there's some identity. So I will speak as someone who's done a lot of work around LGBT inclusion, is I just starting to talk about it. And for me to be talking about it in a nursing home, I mean, we know, I think in general, there's ageism, and part of ageism is, regardless of sexual orientation, people don't want to think about older people as being sexual beings, whether they're straight or not, or people don't want to think about their grandparents having sex. And so being able to speak, and I'll give you an example. A colleague and I, this was early on in my work here, and it was incremental because I was trying to think about how to make changes in an organization that had a 150-year history, and LGBT stuff was never discussed. And there were staff members who are LGBT who had been working for this organization for decades, but that part of who they were, they worried about it being revealed. And there were concerns, would how would the board react? And so it was incremental, but early on, one of the things that I did was had a discussion. So, and it's very powerful to be a rabbi talking about LGBT people as not sinners, but as human beings. And so we had a discussion in the synagogue with my colleague, and there was a woman in the group, a Holocaust survivor who survived Auschwitz. Her whole family was slaughtered. She was in her 90s, very religious. And I had a feeling when I saw that she was in the group that she wasn't gonna like this. And sure enough, in Yiddish, she said, well, isn't it a sin? And my colleague left at that point. He had to go somewhere, but it was convenient. So I was stuck with, but we were normalizing it. We were talking, not with shame and not with discomfort. And I responded to her. 3 weeks later, she learned one of her grandchildren came out. And so you never know. I think when you start having these conversations, you start planting seeds, and you start opening people's minds. And so it really is, I think, about thinking about what strengths and resources you have, because everyone is needed. And it could be as simple as if you hear someone making a joke that is offensive, saying something. But there's also the reality of people need their job. There, unfortunately, people can suffer consequences. So what works for one, and people have different privileges. So so there's a lot of discernment. But I think just speaking however you can, even if it's just with an individual is a safe person to talk about, but maybe to raise some issues. And I think speaking from a personal place can also be powerful. If you feel comfortable sharing some of your story, if you identify as a member of a marginalized group, and we need allies in this. So if you do not identify as an individual in a marginalized group, that's a great, you have a lot of power basically to also to make a difference. So so it began with starting to talk and to educate. So I guess those are the two, is to educate. There's a lot of fear and misinformation because of the stigma. People don't talk. So that would be the first step, and to try to do it with compassion. There's so much injustice and there's so many things that aren't fair, but people won't listen if the message is conveyed in a certain way. So it's having compassion for ourselves and other people, and strategizing is really important.
Thank you, Rabbi Stelman. And so, Dr. Porter, is there anything you'd like to add?
I mean, thank you for sharing that, Rabbi Stelman. You bring up you were talking about elder people and sexuality. One of my original grants was the Pennsylvania Learning Academy for Sexuality Education. And I actually went into a whole bunch of retirement facilities, and some of my best memories was actually talking with older people about condoms and actually having bananas and condoms in the room. And at first they were shocked, but then the stories they tell, as soon as you show a little bit of vulnerability and transparency, and I really love that you touched on vulnerability and transparency and sharing parts of who you are and making that connection to students. So I'm going to go pretty quickly. I just want to talk about two things here. I'm going to talk a little bit about teaching first. I'm going to talk about teaching in practice. So in teaching, it's really, for me, about being thoughtful every single day, meaningfully engaging. And it's not enough to include Black authors. You have to include Black authors and say why you're including Black authors. You have to say, this is a Latina author and this is why she's here. This is a Native American author that's almost impossible to find in public health, or an American Indian author. Similarly, I highlight them every single day in class. I make sure that there are quotes from people of color and gender and sexual minorities in everything that I do. When I am selecting readings, when I'm looking at research papers for students to review in my classes, across all of those, there is a constant thread of, I need to build up and highlight and praise voices of people that have worked way, way harder than the average person to get them to where they are. I talk about privilege in my classes all the time, and I try to get students to understand privilege. If you want, you can send me email. I'll send you you like a dozen different privilege activities I do, because it takes a long time, especially for a lot of the students that I teach here at the University of Miami, to understand that a person of color or a gay person or a woman has a harder trek to get to the same spot. And getting off topic. Get off topic all the time, that's okay. But I get really excited talking about it. So for teaching, it's an activity that I do. I'm active in it every single day in every single classroom, and I'm explicit about it with my students, and I tell my students why and when I'm doing it. In terms of practice, my current work of love, I don't thing that I hate and love? I don't know. So I'm the co-host of the Sex Wrap. It's an online free edutainment, evidence-based podcast that's meant to bridge a lot of sexuality education gaps that are left for a lot of various reasons that hit people of color and gender and sexual minorities the hardest. So we release it every week. We get millions of downloads. We have this huge social media following. You're welcome to check it up at the Sex Wrap. I'm not advertising, but feel free to go check it out. And what we've done there over the last 5 years is we make sure that we highlight voices. When we invite guests, we make sure that those guests are people of color, gender, and sexual minorities. Last spring, whenever all of the protests were going on with Black Lives Matter, for an entire month, we changed the direction of our show, and we talked about the intersectionality of sexuality and race, and we brought on people and shared it to our listeners. And our listeners are young people who want to come have this conversation, because young people are desperate for information if you can do it in a way where you're vulnerable and you're transparent. It doesn't work when you talk at people. I love what Dr. Perez said earlier, like she speaks with the voices from and within those communities. It's really important, and that happens in classrooms and in my practice. And it's been very effective overall. But when we talk about some of the institutional issues that go along with it in the next question, the effectiveness changes a little bit. But really, it's that transparency, vulnerability, highlighting those voices, being consistent about it, and really letting people know why you're doing it. If we weren't using webcam, whatever this program is called, I would have a background today that would have a social justice message going behind me. And I do it at every faculty meeting. And sometimes faculty say, is that appropriate? And I'm like, well, it's much more appropriate than being a racist or being homophobic or misogynistic. And I never want to be any of those things. So I work to be anti all of them every day. All right, thank you.
Thank you, Dr. Porter. Is there anything you'd like to add, Dr. Perez? And I think on the next two moderated questions, we'll just have a couple of people chime in just to make sure we can get to audience questions.
Yeah, sure. I will add one thing that I think is important across all of those three for teaching, practice, and research. And that is, starting with equity first. There's DEI, and over the last year, especially with the murder of George Floyd, these concepts have been elevated. But sometimes I think the way in which we address them, these are not effective ways many times, because a lot of the strategies that I've seen, and I've been doing this work for at least 10 years. So I'm familiar with the concepts, and what I've learned through time is that diversity is not enough and inclusion is not enough. So really, I think that equity really gets at structures and policies. And across teaching, practice, and research, if we are intentional about looking at the structures that really cause inequities, would really help create more meaningful change. And what I mean by that is that really in either one of those areas, if you think about who is historically excluded, and I'm going to focus on academia, for example, just by looking at the number of tenured, non-tenured, and even just faculty across the board, you see right away, the data is clear that there are not enough Black scholars, not enough Latinx scholars, Indigenous scholars, et cetera. We don't have data about LGBTQ faculty. And so what are the structures that we can address from a policy perspective within our institutions to really elevate equity and put equity first? Otherwise, I again think that diversity is about, it's more performative. It's having, I feel like many times I'm asked to be part of things because I'm the only faculty of color, only, faculty working with Latinx populations. And so that as an only doesn't feel empowering to me, because usually what happens in those situations, I'm the only one sort of trying to elevate certain issues, or I have a specific lens on an issue. And so again, so that, you know, the diversity part isn't helping. It's really breaking down structures that are in place and looking at them seriously to see who is traditionally excluded, who is not benefiting from opportunity. And we continue sort of this cycle of inequities across those three different settings.
Thank you, Dr. Perez. That's actually a really nice segue into our next question, which is, we all agree that diversity, equity, and inclusion work is important. However, this work is sometimes not prioritized at our institutions or places of employment, which can pose a significant challenge to our career path and goals. Can you describe some challenges you face in your career and how you overcame these challenges? And Dr. Porter, I guess we'll start with you on this one.
I mean, thank you for saying all of that, Dr. Perez, especially like I'm the same thing. I am the gay member of all of the task forces and all of the committees when they need that gay lens for things. And I don't know if I'm necessarily like the gayest or the most like why is this my voice? But the good thing is there's that cast of characters who are now my best friends across the university who are social justice minded. I won't go into it, but I mean, it's been really interesting, my journey here, but it's just a very small number of people who constantly are thrown into these situations. But if we're talking about, is this important for universities and what are some stumbling blocks, all of the time that I've ever spent working for social justice, equity, and inclusion at the university counts against me, right? Like if I talk about my tenure and promotion, I'm a professor of practice, which means I'm on an annual reappointment schedule. My job is supposed to be about teaching and doing, but every year when I go up for reappointment, they just look at my overall scholarship and they're like, well, why aren't there more research papers? Why aren't you doing these other kind of research things? And I respond back with, well, I've been recruited by the provost, by the president, by the school, by the state, by the, like, you know, I speak at international bodies about sexuality. I think this is important work and it needs to be done. But unless we have some of those infrastructural changes that Dr. Perez was talking about, right, unless we actually change it, like, it's just that illusion of diversity. It's kind of that lip service. And I'm really proud of some of the work that we've been able to do here at my university where we've had centers form, like we've actually seen outcomes, but of all of the task forces I've been on, there've only been a few times where we've really seen like those tangible outcomes of all of that hard work and effort. Sometimes I'm told to quiet down. Sometimes people don't want to have that conversation with me. You know, sometimes you get chastised because you are in a situation and someone says something that's a microaggression towards another. I was at a faculty meeting not too long ago where somebody said, crack hoe. I'm like, I don't think you understand the racial context of that term and how there are a lot of people in this room who are probably afraid to say anything about it. So I stand up in front of like 40 faculty and make this kind of conversations, which I think are important. But at the end of the day, a lot of the times the people who are evaluating and adjudicating our work, looking at things like tenure, promotion, raises, et cetera, don't have the same ethic that all of us do. And I hope that all the people who are watching today understand, like, I do these things because it's important, because I care, because I do want to make sure that tomorrow's a slightly better day. And I think like in the back of everyone else's head, they sort of have it, but they're sort of afraid. Like I said originally in my opening statement, like we're taught that being vulnerable is dangerous and risky and you're supposed to know the answers. Or if you complete a cultural competency module, suddenly you're competent. I ask my students all the time, who here feels competent in your own culture? And they all kind of like look side to side and chuckle at each other and like, nobody's competent in their own culture. So cultural competency training in and of itself is a part of the overall systematic problem that lets people think that they don't actually have to take action. I think that's enough. All right, thank you.
Thank you, Dr. Porter, for your passion. Would anyone else like to answer this question or add anything else?
I will add that I thank you for this question, Dr. Bonds-Johnson, because yes, you know, everybody talks about DEI or there's a lot of performative work that we see across the board, but to make it a priority, there have to be resources and incentives and recognition of the hard work that goes into this. Oftentimes, faculty that have been doing this work for years, their true work involves the community, involves mentoring students that are traditionally, historically excluded. There's a lot of service work, you know, that this is considered service work, and it's not prioritized when it comes to promotion and tenure. And so I think the way that we have to sort of form alliances with colleagues and continue to speak up for the needs of this work in our institutions is by showing that it's valued through promotion, through tenure criteria, and through investment. This work cannot be left just to the faculty of color in an institution. It requires resources of those faculty, whether that's time that you're given to truly make meaningful progress in this work. And that comes from really the top at institutions, that you see the value, not just because it's the words are part of a mission, but that you see that operationalized through incentives, through research funding, through your startup funds, real tangible benefits to it. Again, otherwise it becomes sort of nice to do work. That's nice that you're doing that, rather than truly valuing the work for what it is. It's hard work, but it's work that can change lives.
Thank you so much, Dr. Perez. Rabbi Stelman, I don't know if you want to add anything to this question, and then we'll get to audience questions, and then that actually was addressed to you, I think, Rabbi Stelman. So you let me know.
I just wanted something that came to mind, and so this is like thinking big, but putting it out there. Hopefully, some of you can do some thinking of how to do this. But in terms of the equity component, many of us work at an institution that has different departments, including housekeeping or plan ops or security. And I work at a skilled nursing facility, and the people doing the most holy work are the nursing aides and the nurses. And the nursing aides help people who need help going to the bathroom and being washed. And the pay disparity, I don't know actual numbers, but I am guessing that there's a big pay disparity. And I mean, and this is connected to public school teachers and their salary. I think our society, I don't understand how CEOs can have one salary and the people who are really caring for the most vulnerable, and doing this really holy work have a very different one. And if you look at the makeup of who's doing this, there are a lot of people of color, a lot of immigrants. So this is not really answering this question, but it's connected, because this is all about trying to make this world a better, healthier place. And again, I don't have the answers to it, but maybe that's also part of the discussions and thinking that needs to happen, because people won't have opportunities and resources if they're working 3 jobs to put food on the table for, so how do we try to think about reallocating, or the whole concept of reparation? It's a huge topic, but I think as Dr. Perez said, the equity component is a really big part of all of this. And if we just take a meta step back, it's multiple layers. Thank you.
Thank you, Rabbi Stelman. We actually had one more moderated question, but we're going to skip that question for the sake of time and go to audience questions, because we have 2 audience questions that have come through. For those of you that still have questions, please feel free to put that in the question box section, and we will hopefully be able to have your questions answered live. So the first question is, how do you begin having anti-homophobic conversations in long-term care communities, especially if those communities are associated with religious organizations?
So thank you for the question. I have to say that in terms of strategizing, I think every moment is an opportunity, but you have to think, what is the opportunity here? And I think it was a confluence of multiple factors that I saw opportunity that I was quick to grab. And that would take a whole long discussion, but it had to do with people I knew could be allies, and that goes back to the strategy. But But one thing I did was I looked at the language that the organization was using to talk about its mission and vision, its values. And I was able to present this idea of providing services and care and doing the work to become a place of choice for people who are LGBT to work and to receive service for it, that actually aligns with the vision and the mission and the values. And that, I mean, I think that's what part of this is. We can say, you know, the United States has some great texts like Declaration of Independence, but we are still not there. And so with our organizations, and so that's what I did. That's how I began it in terms of the administration level. Was to communicate in a way that was using language that people got the case that I wanted to make, and to show that it was aligned, but and to do it incrementally. So I don't know if the question was in terms of the institutional leadership or working with residents, and then talking to staff. I mean, we have a very diverse staff, different religions, and that's been interesting. So thinking about how to develop staff training and when we do new hires for orientation, I do a discussion, and most people who've worked with older folks in senior care have not ever heard someone from an organization talk to them about LGBT inclusion. So they're different conversations depending on who the audience is, and I'm not sure if the questioner had a specific audience, whether it was like the leadership or coworkers or family members or the residents, but hopefully I touched on some of that.
Thank you, Rabbi Stelman. Dr. Porter, I don't know if there was anything you wanted to add since you also do work in this area, or if we wanted to move to the next question.
I mean, I don't really talk too much to elder populations. I mean, I did condom trainings and STD trainings, so I don't really have too much to add. But when I do talk to people, like when I'm working on anti-homophobia, misogyny, racism, one of the places I do like to start is like everybody has a time in their life where they felt like they were treated unfairly, and tapping into those feelings that someone has and having a conversation about how they felt in that situation, and then helping them, you know, build empathy skills and translate that to another person. But I don't really have anything to add about, like, that's not where I am these days, but thank you.
Thank you. And on to the next question. Is there a framework or theory for nursing faculty to implement diversity, equity, and inclusion work in classrooms and administration? And Dr. Perez, I will throw.
Yeah, so earlier, you know, Dr. Stelman brought up intersectionality, and that's a term that was first coined by Black feminist scholar, Dr. Kimberly Crenshaw. I think we really need to acknowledge her amazing and long work in this area. I think that the framework of intersectionality, you know, as described by Dr. Crenshaw, gives us a way to begin to look at, if we're focused on policies, for example, how groups that are identified by gender, race, class, ethnicity, you know, all of those issues, how those different identities marginalize and exclude people and cause inequities to exist, whether it's in healthcare, whether it's in education, et cetera. I think that you know, I am learning more about the framework and really feel like it applies to my own work with people that are immigrant, people that are farm workers that are often here undocumented and exploited. And so not only are, you know, immigrants and farm workers, for example, you know, we can look at them by gender, race, ethnicity, but also being an immigrant and not having access to health care. You know, I through COVID-19, for example, these were communities that were making sure all of us had food on our table, yet they were excluded from many of the administration at the time, their provisions on COVID-19, information, education, you know, testing, all of those things. So I think, you know, when I think about her framework, it helps to sort of break down the different experiences that people have based on their identities, and then I think we can tackle very specifically where those issues lie, where those challenges lie, and address them in a very systematic way through policy, and be able to also measure change, through our work. So I feel like that's an excellent framework for all of us to think about, whether we're teaching, practicing, or conducting research.
Thank you, Dr. Perez. I don't know if anyone else wanted to add anything to this question about other frameworks or theories that they like.
I mean, I just think Dr. Perez also hit on, with the intersectionality and the examples she used, that with people who are undocumented, how can people use the privilege and the power and the safety they have to be creative and think about how to help people, because sometimes what may seem the obvious route is actually going to do more harm than good. So so I think creativity is very important and thinking outside the box.
Yeah.
We have one more question. I'm going to try and get it in before we run out of time. What are your thoughts on how to approach the issue of representation on academic committees when faculty members of marginalized groups are likely inundated with committee and other service work?
I mean, I think this, I sort of touched on it a little bit. I think, and all of us have sort of talked about using our own privilege to speak up for these issues, and saying something when you see those, those factors come into play in the way service is allocated in our institutions. So when you see, we have a handful of faculty of color, and it's sort of, again, that's why diversity isn't always helpful, because you try to put the same people in all of these committees, and it is not helpful. And in order to really address this issue, our workforce has to change. We have to make intentional efforts at the recruitment and retention of faculty of color and historically excluded groups to academia to truly change that. And that's going to take a lot of work, but I feel like, I think it's work that hopefully there's momentum for us now to make that change.
Thank you, Dr. Perez. Any lasting comments as we get ready to wind down and end this webinar?
I mean, the work that we're all talking about and doing, oh, my camera is going crazy. It's hard work. It is heavy lifting, and it's unrewarded, right? It's rewarding, but I mean, I love what Dr. Perez was saying, like we need to have universities change that structure of reward so that if you do this kind of work, you do get promoted. I mean, we have to make sure that we get out there and build groups, build teams, get together and support people, lift them up with you, because making other people shine making the room brighter doesn't diminish you, right? It makes everything a little bit better. And
thank you, Dr. Porter.
sorry, I'm having some tech issues.
Oh, sorry. Rabbi Stelman, any last words before we end this webinar?
I just want
I'm really thankful.
Say, sorry.
Sorry, I think we were probably going to say the same thing, Rabbi Stelman, that we're just so grateful to ESPO and GSA and Dr. Bonds-Johnson, you and all the leaders that brought us together. I'm so happy to be here with you and to just have this conversation. I think you are doing a lot of what you were asking us, like, how do we begin to change this? And it is by having these conversations that are difficult sometimes, but not shying away from them and making them a priority. So I'm so thankful to you. And, I look forward to continuing our discussions through GSA and elsewhere.
Yes, thank you so much. As we get ready to wrap up this webinar, I would like to extend Our sincerest gratitude to our 3 speakers for their time, effort in preparing for this webinar and for sharing their knowledge with us. We have listed our speakers' emails in case there is anything you would like to follow up on. So their emails are listed. Thank you again for our speakers for their time. Thank you to our audience for your attendance. And I would like to point out that you will receive an email after this webinar to complete a survey. We hope you found this a useful and meaningful experience. I know I did, and I've learned a lot. But again, if you could fill out that survey, it'd be really helpful for us as we continue to create programming for you. And thank you, everyone.
Thank you.